Welcome to the Renal Research Institute's Frontiers in Kidney Medicine and Biology, where we share knowledge and advances in kidney research with the world. In today's episodes of Frontiers in Kidney Medicine and Biology, we discuss the intersection between kidney medicine and the United Nations Sustainable Development Goals. My guests today are nephrologists Dr. Valerie Luyckx and Dr. Marcello Tonelli. Both collaborate with the World Health Organization and the International Society of Nephrology and other international bodies to advance the field. They have made significant contributions and have raised awareness in the kidney community on this important global topic. It's a great pleasure for me to welcome Dr. Valerie Luyckx from Zurich, Switzerland, and Dr. Marcello Tonelli from Calgary, Canada, to this week's series of Frontiers in Kidney Medicine and Biology. And actually, the topic of our talk is really kidney disease in our rapidly changing world. And both of my guests have a lot of experience dealing with global questions regarding kidney disease. And I may want to start off with a question. Actually, Valerie, for you, can you say a few words about the United Nations Sustainable Development Goals? What do they mean? What are they? So just to ground our audience.
Okay, thank you, Peter, and thank you for inviting me to participate. So the United Nations Sustainable Development Goals, or for short, the SDGs, are actually 17 goals that were developed over a reasonable period and were finally adopted by all the countries that are signatories to the United Nations in 2015. These are actually 17 goals that evolved after the Millennium Development Goals, which were adopted in 2000, in order to try to improve health. But not only to improve health, that was not the primary goal. The largest goal is reduce poverty, to improve equity, to improve the planet, the health of the planet, and the circumstances in which people live and work, as well as protecting the environment and encouraging peace and collaboration, because there was recognition that we need this extremely holistic approach to try to achieve healthy people living on a healthy planet, which is really the best way forward for all of us. And so each of these 17 goals are aimed at achieving components towards the bigger goal, and only one of the 17 is actually related to health.
Yeah, so that's very interesting, and I think those goals are more important than ever. I mean, when I look at them. So I'd be interested, Cello, how did you actually become interested in those SDGs?
Well, the SDGs are a transition from the Millennium Development Goals, which were the first set of goals. And I became aware of those when I was a junior faculty member in Edmonton. And I was really struck. The Millennium Development Goals were more focused on health, but they were equally aspirational to the Sustainable Development Goals. And they had targets like, we're going to have world poverty. We're going to cut rates of HIV infection by 50%. And so there were a lot of the goals were about health. They were also about development and the link between health and development. I was just fascinated by these. They were quite different than, I love being a nephrologist. I love focusing on kidney disease. There's many reasons why nephrology is a very attractive career, but on the other hand, you're looking at a very focused piece of the health equation. And what I liked learning about the Millennium Development Goals was how broad they were and how they were so bold and ambitious, and how they highlighted the links between good health, wealth, development, security, all the kinds of things that we would aspire to for our children. So I became interested in them back then, and I followed their progress. I wasn't involved in any way, but just as an admirer, as I watched development agencies act on these aspirational goals. I think the one take-home message for me from all of this was that what gets measured gets done. We've heard what's get measured gets managed, but the bottom line is if you don't look at something and measure it systematically, you're not going to see improvement. So I became interested in these goals back at the time of the Millennium Development Goals, tracked their progress, and I've been very interested to see their evolution into the Sustainable Development Goals, as Valerie mentioned, which are less explicitly about health and broader, more about societal benefit. And then I think this topic came to your attention because of the work that Valerie led on how the SDGs might link to kidney health. And so that was really Valerie's idea and Valerie's leadership that put those two ideas together, expanding on how, what's in it for nephrologists.
Yeah, you're absolutely right. It was really Valerie's work that caught my attention, and I think also the attention of other nephrologist colleagues globally. Now, Valerie, how did you get involved, interested in the SDGs actually?
I think, as Cello also just mentioned, the Millennium Development Goals were great. We were all quite enthusiastic, exactly as he said, what gets measured gets done. And the bottom line is, from our point of view as nephrologists, the focus from the health point of view was maternal and child health, HIV, TB, and malaria. And so all the countries, because when countries sign on either to achieving the MDGs, the Millennium Development Goals, or the SDGs, they are then required to actually show their progress. And a lot of the development agencies also started to put all their money into these four categories, and countries were achieving progress, but basically forgetting everything else, or not forgetting everything else, but diverting a lot of resources to achieve these very defined goals. And one of my research interests and academic interests from being a fellow with Barry Brenner at the Brigham was really this idea of developmental programming. And when one thinks about how the fetus develops, one has to think the mother has to be healthy, because a healthy mother will have a healthy baby who has a better chance of having healthy kidneys throughout their whole life. And so in trying to go through that, one starts thinking, what is a healthy mother? She has to be well-fed, well-educated, strong person in a strong environment, etc. And all of that really just obviously takes you back to this idea of primordial prevention of kidney disease, which is really making sure that every mother is as healthy as she can possibly be, and as safe and as flourishing as she can possibly be. And obviously each mother is in a society, and that means the society has to be flourishing. And so that's really when these SDGs came out, I started to think, well, this is quite obvious. You make an extremely healthy person and the next generation will be healthy. And I think the focus on well-being rather than illness is what attracted me as well.
I have to say, Valerie, this is just so fascinating. I mean, when I think back in my personal and professional career, reading in the, whatever, I guess, 1980s about Barry Brenner's work on developmental programming, on oligonephrogenesis, etc., 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 who would have thought that out of this concept spawns the realization that actually it's part of a much bigger picture, right? And that actually it's maternal health, which is a function of societal choices that are made. And so this is really fascinating to learn. So really thank you for sharing your story. Now, I'm wondering, Valerie, and maybe I'm sure Cello would also want to add to this, what's actually the intersection between kidney medicine and the SDGs?
Well, and also just to backtrack a tiny bit, sorry, Cello, I think Cello was actually leading together with the Dear 11 and Kai Eckhart this global kidney, sort of this roadmap. And that's how Cello and I together got involved in this, because this roadmap was also going all the way from prevention through care. And so I think that's how we kind of started to realize that there was the synergy, and also coinciding with the Lancet campaign at the time. So I think there Cello has also facilitated a lot of this moving forward.
Yeah, thank you for adding this important point. Cello, is there anything you would want to add, and given the way how you got involved?
Well, I think that, so there's a couple of aspects to that. I think the first is that on the face of it, the interesting part is that you can trace a line between these broader goals and kidney health specifically. The example that Valerie gave and that you mentioned as well. Who would have thought that those would link? But I think, and that intellectually to us as nephrologists, it's very interesting to see those links and to know that there will be a benefit for kidney health. I think the flip side is that we are all citizens. We are all hopefully concerned about the well-being of the planet and of future generations. And I think the flip side of this is there's something on this list for everyone. There's something on this list that everyone can get excited about, no matter where you start. And I think for me, part of it has been I'll just pick an example, Sustainable Development Goal number 5. I have a daughter who's now an adult. Of course, I believe in gender equality and empowering women and girls. But it wasn't until thinking about the MDGs and the SDGs that I realized that there would be explicit benefits for health generally, and also for development. Now that seems obvious now after a couple of decades of thinking about it. But I think the second point is that I just made is that there's something on this list for everyone, and I think it should be getting us outside our specialist box. That's how I think of it. We can all make contributions in our area as specialists or subspecialists. Whether we work in an academic hospital or community practice, we are the experts, the content experts on kidney disease, and that's great. But we also have a role outside our immediate professional lives, I think, as citizens. People will look up to health professionals and those working in the field of health. And I think that's where, for me, that's been this sort of consciousness broadening. I don't think of myself as a particularly progressive or whatever person, but I think that this list has been helpful for me in terms of my personal development about thinking these things and why they're important. So that's been something, I guess, a source of personal satisfaction. As a result of the work on the MDGs, these early series in the Lancet that Valerie talked about, I started reading the Lancet for interest. And it was the only medical journal, still is really, the only medical journal that I read just because I'm interested in it, not because I think I need to read it to keep up or for my content expertise. I just read it because I think it makes me a more knowledgeable, I guess, citizen scientist. So those are the things I think about when I think about the SDGs and the MDGs before that.
Yeah, so really, thank you for sharing this story, and it's always interesting for me personally, and I guess also for our audience, to understand how people get actually interested in something, how did they get involved, and what I'm taking away that you had different points of departure in a way. But then your interests clearly converged and you joined forces to advance this field in such an outstanding way. Now, I'd like to come back to my earlier question. So where do you see actually the intersection between kidney medicine and the SDGs?
So I think there's 17 SDGs, and we can definitely make a case for every single one of them. I think, the obvious example, the one is maternal health. We all think about access to clean water. We have to remember that there are still billions of people without access to clean water. Enormous amount of schools where children can't wash their hands, where there are no toilets and things like that. There are 4 billion or so people who get diarrhea every year. There's 800,000 something people who die of diarrhea every year. And we have no clue, and this is one of the hopefully things that will come out of the Sustainable Development Goal for Health, is this idea that we need to measure the burden of kidney disease better. But we don't know how many of those 800 million people dying of diarrhea are actually dying with AKI or of AKI if they don't have access to dialysis, for example. We know that something as simple as educating girls, so improving education for girls and boys, because worldwide there are fewer girls enrolled in schools than boys. Every year that a woman is educated increases raises her out of poverty, improves the health of her own children, improves her ability to actually earn more. So there are all these sort of snowball effects. So I think there are a lot of, each one of the SDGs can, translate into something. We know occupational health, for example, with the CKDU epidemic in Mesoamerica or in India, Sri Lanka. It's people who are working in conditions that are suboptimal. But I think there's another part of this, is that in medicine, we're often going out and asking everybody, help us, give us money. Whereas here, if we from health are also advocating for all the other SDGs, we are also being better citizens as members of the health system. And also don't forget that as the health system, we can actually contribute very constructively to a lot of the other SDGs, not only for advocacy, but also practically, because health systems are actually very common places of employment, training, education, opportunities, etc. So I think, there's a give and take here, rather than health and the health system and the sick always being these passive recipients of something from outside. And I think this helps us as nephrologists to try to also be more proactive and advocate. And I think the critical thing also is that there are so many other diseases that are linked with kidney disease, like cardiovascular disease, cancers, etc., all differentially impacted by the SDGs, but everything then all comes together.
Yeah, it just shows in a way the interconnectedness of promising questions. So Cello, what is your view on this intersection between kidney disease and the SDGs?
Well, I think Valerie put it very well, and I think for those that are interested in a really detailed list, the Valerie's publication in the Bulletin of the WHO in 2018 has a list. I think I'll just highlight a couple of things. The first is just to reiterate what I said before, which is there's something on this list for everyone. If you're thinking about kidney disease specifically, you can find a development goal and you can trace a line to how it will improve kidney health. And that's sort of my take-home message. One specific one I will highlight, something that I think is close to my heart in the health area. It's the idea of universal coverage for healthcare, universal healthcare, UHC, ensuring that everyone has access to a minimum basket of drugs and medical services. And why is that important? Well, it's pretty simple. We get a lot of the bang for the buck with preventing kidney disease with access to good primary care, cheap, simple, easy to use medications that either prevent kidney disease from developing or slow its progression. So I think that's something that, I think every person that's interested in health should be interested in universal healthcare and strengthening primary healthcare systems worldwide. I think the other point that I would make is about the impact, and it's a related point, is how does development fit into that? Right now we're exiting a time. We came from the MDGs where there was tremendous optimism, huge progress, like I said, goals being met that meant have this or double that. And that's where the SDGs came from. There was a real sense of optimism with the SDGs at the beginning of the SDG era because economic growth seemed to just explosive. It seemed that just by simply continuing to allocate a small amount of our wealth in richer countries, and even the poorer countries would continue to have growth, and they could set some of that growth aside to make these goals possible. I think a comment that I'll make now is, the world looks different now, doesn't it? We're in the middle of a pandemic. We're all focusing on infectious illnesses. There's retrenchment. There's been a change in global politics unrelated to that. And so we are seeing backsliding on commitments, and I think just a loss of interest, a loss of momentum. So what to do about that, I'm not sure. I think it's just to remain optimistic and to remember that, we are going to emerge from this pandemic, and we have to keep some of these aspirational goals in mind for the future. Not just this sort of sterile build back better comment that you read in the newspaper, but really thinking, we can do these things by setting aside a relatively small proportion of our gross domestic product in rich countries to address these goals. And the final point is about, I completely agree with what Valerie said, which is that it's nice to think about wellness, not about just taking care of sick people, to think about health in this more holistic concept. And because there are so many goals and so many of them linked to better health in one way or another, there's an idea called health in all policies, which means that when we see a policy made by government, whatever that policy is about, that probably it has an impact on health. The example being, we could pick any policy, but let's pick roads. Let's imagine that a country decides to deprioritize road repair or road development. It can do that. That may be a very valid choice. But Health in All Policy says that when you're thinking about proceeding with that policy and you're assessing the pros and cons, always remember to apply a health lens. Because health is such a big driver, you may forego that road maintenance. If your road infrastructure is weak, that will lead to preventable deaths that you otherwise would have avoided, avoidable hospitalizations, and then for the nephrologist, it will lead to an increased burden of kidney failure and maybe catastrophic expenditures related to kidney failure from trauma. So it's just a way of thinking, and I think that it's I'm a Canadian person, and Canada's been a leader historically in the development of health and all policies. We'd like to see more of it in Canada, but we'd like to see more of it in all countries. I think it helps get us into this SDG mode that will help us think about how to improve more health more broadly.
Yeah, and I think, Cello, the example you just gave highlights that the interconnectedness and making a change on place A has an impact on place B, C, D, E. And this is something that really is important to recognize and to consider. Now, let me follow up with you, Cello. What is in your mind actually the biggest impediment to advancing kidney medicine globally?
Wow, that's a good question. I think so I think very simplistically about kidney health. I don't immediately leap to dialysis or kidney transplantation or something. As I alluded to earlier, my thoughts gravitate towards the availability of cheap, simple, protocolized medications that integrate with the other NCDs, these like diabetes and hypertension. So I think that the two main threats that are interlinked. One is a lack of a system for financing and delivering those cheap, simple medications. And the other is siloed thinking, which is that whenever a specialty, a discipline comes forward and with the best of intentions, kidney disease is important. Let's stamp out kidney disease, and we go forward in this way, and it's beautiful and it's progressive and it's well meant, but it may miss opportunities, the big picture, where maybe it isn't about kidney disease. Maybe we don't even measure kidney function. Maybe we just make sure that we've got blood pressure control and diabetes control, and we know that that'll take care of most of the kidney disease. That's just an example, but I think those are two of the big threats. And then of course, looming in the background is that we're going to emerge from this pandemic, and we're going to retrench to a more selfish way, globally speaking, of thinking that holds us back on these lofty goals.
Yeah, yeah. No, thank you. And Valerie, is there something you would want to add or provide your point of view?
Yeah, I think something that's slowly sort of also gaining recognition, and a lot of this comes from the work of Margaret Kruk, who's at the Harvard School of Public Health. She's published some phenomenal papers on the quality of healthcare delivery, because I think it's great. I think we need the right medicines. We need protocols, but we need healthcare workers to be aware to make the right diagnosis at the right time, give the right treatment, and the person needs to be able to get enough of that treatment at an affordable price to be able to really control the disease, let's say their blood pressure. Because in the study of Margaret Kruk, I think it was 2018, there were about 8 million amenable deaths in low and middle income countries, of which 5 million were actually because of poor quality. So 5 million people got to the healthcare center and were not treated appropriately. 3 million died because they never got to the healthcare center. But we often think people don't have access, they don't get to the clinic in the first place. But what we have to realize is very often they get there and the quality of care is not correct. And so I think a huge barrier, and exactly, I think what Cello mentioned is this idea that we mustn't bring kidney as a whole extra new list of problems, diagnoses, etc. It's the same thing as when you have a patient with heart disease, stroke, diabetes, and kidney disease, you tell them to follow a diet. It's the same diet. The patients get scared and they think, oh no, I have 3 or 4 different diets I have to follow. It's one diet to keep themselves healthy. And I think this is the same thing with prevention of these cardiovascular disorders. We need to just simplify so that policymakers and managers don't have to think we need multiple different programs. We need an integrated approach and a quality approach. And a lot of that depends on all the building blocks of the health system being in place sustainably and reliably. And financing is obviously critical to the whole process.
Yeah. So we discussed a little bit the impediments. I'm really wondering, do you think that, or do you see really serious efforts by societies, international bodies, industry, to improve the situation, to improve, more specifically also kidney health?
Are you asking me?
Yeah, if you would.
I think obviously both Cello and I are involved with the International Society of Nephrology. I think they are trying to reach out globally. I think we've seen amazing steps forward in the American Society of Nephrology in terms of funding now for transplantation, in terms of innovation. So I think in the American Society also, I think the European Society is trying, and I think every national society is trying to improve kidney care in their countries. I think in terms of industry, some large companies are trying on a large scale to support, for example, blood pressure control. I agree with that. But I think industry has a lot of conflicts of interest. The dialysis industry specifically, I think we know that there are between 2 and 7 million people every year who die because they have no access to dialysis, and there is still reluctance to decrease prices, to improve transparency about pricing, to improve delivery of supplies or allow, manufacture locally, etc. So I think industry tries. I think they may have the will, but I feel there's a lot more that could be done. And I think the societies try, but they also are not action bodies. They're largely more advocacy, training. I think the ISN has done a lot of capacity building in terms of training nephrologists and creating opportunities. So I think there's definitely hope, there's progress, and now also patient groups are gaining momentum and having louder voices. And hopefully that's also going to somehow bring a little bit of a change. And I'm hoping that this global focus on inequity for vaccines and this idea that the pricing is still not being brought down adequately for vaccines, we can leverage in the kidney world and say, everyone's aware of all this inequity in terms of vaccines. Why not in terms of other, unfortunately, expensive care like dialysis?
Yeah, so I'm so glad you bring this up. I was thinking really around the question of vaccination, availability of vaccines. Is this a kind of a lens that on a really global level highlights the inequality to an extent that it, at least I cannot remember, that has ever been done before? So I guess more people now are aware of health inequalities globally than there had been before the pandemic. I don't know, Cello, would you agree with that, or do you want to bring in a different perspective?
No, I do agree with that. I am just smiling because I have heard many times, read many times, as we all have, how the pandemic has laid bare this or that. And, it sounds a bit snotty, but my response is you just haven't been paying attention if you think the pandemic laid them bare. They were there all along. And it's just we read about it a little more now. So I do think it's more top of mind for many people. I think it's just been outside the wheelhouse of what people are thinking about. We only have so much capacity to think about things, but I think those of us, whether we live in a rich country or a poor country, there are gaps in the gaps that we see every day in access to health. I think it's maybe a little more surprising that that it applies to vaccines, just given the immediacy of the situation. But it's all the same. I think I'll just come back to what Valerie said. I completely agree with what Valerie said. I'm a huge fan of the work of the ISN. I think it's been amazing. I think it's actually helped the other societies to see the value of getting involved, because there's, it's a worthwhile endeavor in its own sake, but it's also very rewarding. And I think that's why the other societies may be offering these things, is there's a demand for it. People the society members want to contribute by participating. So that's to be celebrated. On industry, I think part of it is, companies are companies and they have a responsibility to their shareholders. They're not there to save the world, and everyone understands that. I think where there may be opportunities is to show where interests align of society and of industry. So back in around 2003, 2004, I started working with Dr. Guillermo Garcia Garcia in Guadalajara. And I became aware of a company named PISA, which is a Mexican company that makes dialysis equipment. It made PD equipment. It also made hemodialysis equipment, and it also helped to run dialysis units, as I recall. And what I thought was really progressive about this model was that the company was paid a lot. It provided heavily subsidized materials for peritoneal dialysis, which was most of the patients who were indigent, couldn't afford this. The hospital and charitable organizations paid for some of the freight, but the company made a big contribution. Why did it do this? Yeah, it did it because it thought that it was important to help Mexicans, but also because they knew this would give them a foothold over the long game decades long, which has come to fruition, and they're, a big player in that marketplace. So it's trying to show those pathways where being a good citizen really is rewarding. And, I'm a little skeptical also, but I think there are some of those opportunities, and that's what we have to highlight, whether they're for vaccines or they're for dialysis equipment. On that note, one other thing while I think about it is SGLT2 inhibitors, so they're like, we're thinking about nephrology, we're sort of at this crossroads, right? We have these super exciting new treatments, and they're very promising. And if you look at what the companies are doing, and this is what I would be doing too. It's very similar to what we saw anytime a new drug comes out, like a potens for anemia or cinacalcet for hyperparathyroidism. It's banging the drum to show, hey, there's lots of kidney disease and there's lots of people that would benefit from, so that's great. And what we need to see is a coupling of that, hopefully, with efforts to make those medications accessible. Wouldn't it be wonderful if SGLT2 inhibitors were part of that low-cost basket of treatments? And then we could really expand the number of people that were receiving those drugs, which would help the companies, but it would also help those people and keep them off dialysis and keep them healthy.
Yeah, absolutely. I mean, this is actually a very, in a way, optimistic outlook, that there are also new interventions on the horizon. It's not just dialysis. There is, in the preventive field, there are many opportunities ahead. Well, I mean, we are coming now slowly to the end of this conversation, which I have to say I tremendously enjoyed, and I've learned so much from the two of you. Recently, the first xenotransplant, a kidney from a pig, was connected to a human. How do you see the emergence of xenotransplantation from a medical and societal perspective?
Well, I can start. I think it's obviously hopeful, but it definitely feels extremely utilitarian to generate these animals for this. So I feel as well now, as also going back to the SDGs, we all know that meat eating is a huge load for the climate, generates a huge amount of CO2 and all this. I don't know what these pig sort of generation would lead to in terms of climate change, etc. I think if you're thinking of the sort of millions of people on dialysis waiting for a transplant, this would have to be, millions of pigs. I think, so there's a lot for me of ethical aspects. I think it's extremely high tech, it's extremely sophisticated, and so definitely, at least in the short term, but probably even in the medium to long term, will not be the answer to global transplantation. And then I think we have to recognize that pigs are not animals that are considered acceptable by various populations in the world, Muslims, Jewish people, etc. And so in a way, if this may even discriminate against certain populations. So I think this is complex. I think it's phenomenal that science is taking these steps forward. I think, it's amazing, but I struggle a little bit from the ethical side. But again, if you can, provide life to people, one has to really think what is, what is justifiable in order to do that. So I was interested to read it last week in the New York Times, I think it was. I came across it, but yeah, I don't think it's a simple answer.
Yeah, and I think that's this might be the most honest answer, that this is a really difficult question. But we have to face it, because this will happen. Cello, what do you think about that specific?
Well, I think you got a much more thoughtful answer from Valerie than you would get from me. I'm from Alberta. It's like the Texas of Canada. I'm a meat-eating kind of a redneck nephrologist that, so I do, there's clearly are ethical issues to be resolved with xenotransplantation. I'm also kind of a not very ambitious thinker. So again, my thoughts come back to, I congratulate Dr. Montgomery and the team. I think it's wonderful what they accomplished. We need people like that, visionaries that are going to keep moving in that direction. I have no doubt that, I shouldn't say I have no doubt, I'm confident though, that I believe that the xenotransplants are going to happen. It's just a question of when. Whether they're going to be, you use the term short or medium or long-term success, because I'm a pessimist and I believe more in these lower tech solutions, I think that's where we're going to get the short and the medium term goal. But we know from these pithy aphorisms that because of exponential growth, that we all underestimate the benefit in that sort of 10 to 20 year horizon, because there's so much growth at the exponential end of the curve as developments occur. So I might be wrong in that. Maybe xenotransplantation will be a viable solution for some in our lifetimes. Very interesting question. Thank you, Peter.
No, sure. And I find both of your answers really interesting. Just much more to think about it. It's always when these sort of breakthroughs happen, one is inclined to be overly enthusiastic maybe and forget about, there are questions around the corner that need to be addressed, like the ethical ones that Valerie raised. So so as said, we are coming to the end. May I ask you, Valerie, and then Cello, what is the most important point you would want to bring across to the audience?
I think the biggest thing is the focus on equity. We need to try to improve equity in all spheres. And I think that's kind of the heart of these Sustainable Development Goals. And I think that's how we as a society can actually move forward. And I think that's related to COVID. And I think it's related to kidney disease. It's related to everything. So I think we just need to be more conscious in terms of trying to support equity wherever we can. And hopefully somehow, if we all try to achieve that, problems will almost solve themselves.
Thank you, Valerie. And Cello, what are your what points would you want to bring across as a take-home message?
Yeah, it's an excellent question on a complex topic. For me, I think that my take-home message is that although these goals look lofty, they look unattainable, pie in the sky, I believe they are achievable. And I believe that the Millennium Development Goals showed us that if we put our minds to these goals, no matter how difficult they may seem, that we can achieve things that over time, over decades, that seem unimaginable. And I really think we should not give up on these goals. We need to turn our attention back to them. As the pandemic moves into the rearview mirror, we need to turn our attention back to these and make them happen in some way.
Yeah, so thank you both. And on that optimistic outlook, I think our conversation has come to an end. I really, really want to thank both of you. This was just a wonderful half an hour. As I said, I learned so much. And of course, we were only able to touch on a few topics without the ability to go really deep, but I think you provided some very important insights. So really, thank you and have a good remainder of the day.
Thank you.
Thank you, Peter.
Thank you for joining the Renal Research Institute for this episode of Frontiers in Kidney Medicine and Biology. We invite you to engage with us on our social media channels and look forward to seeing you again for the next episode on Frontiers in Kidney Medicine and Biology.